Aminocaproic acid is a medication used to help control bleeding caused by a condition where your blood does not clot properly, fibrinolysis. This can lead to serious bleeding after certain surgeries or in conditions such as bleeding disorders, liver disease, or cancer. Aminocaproic acid works by helping your blood to clot normally. It belongs to a class of drugs known as antifibrinolytics. For people with concerns about aminocaproic acid, it is important to note that the benefits of this medication include helping to control excessive bleeding. The daily dosage and timing will depend on your specific condition and the guidance of your healthcare provider. It is crucial to follow their instructions carefully to ensure you are taking the medication at the optimal time for your individual needs. When taking aminocaproic acid, it's important to follow your doctor's instructions carefully. The dosage and frequency of the medication will be based on your medical condition and how you respond to the treatment. Your doctor will monitor you closely until your bleeding is under control. It's crucial to take this medication exactly as prescribed to get the most benefit from it. Do not skip any doses, and do not increase your dose or use it more often or for longer than your doctor has directed. Using it improperly will not improve your condition any faster, and it could increase your risk of side effects. If you're using the liquid form of this medication, be sure to measure the dose carefully using a special measuring device or spoon. Using a regular household spoon may not give you the correct dose. Be sure to tell your doctor if your condition persists or worsens. Side effects of aminocaproic acid may include headache, stomach pain, loss of appetite, nausea, vomiting, diarrhea, unusual tiredness, dizziness, stuffy nose, or watery eyes. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as a persistent sore throat, ringing in the ears, changes in vision, muscle pain or weakness, signs of kidney problems, confusion, slow heartbeat, unusual bleeding or bruising. Seek medical help right away if you have chest pain, shortness of breath, or seizures. Although rare, a very serious allergic reaction to this drug may occur. Get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking aminocaproic acid, it's important to let your doctor or pharmacist know if you have any allergies or if you have a history of heart disease, liver disease, kidney disease, or any other blood/bleeding disorders. This medication may cause dizziness, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Limiting alcoholic beverages is also recommended, and it's important to discuss marijuana use with your doctor. If you are planning to have surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, aminocaproic acid should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, it's unknown if this medication passes into breast milk, so consult with your doctor before breastfeeding. When taking aminocaproic acid, it's important to be aware of potential drug interactions. Certain medications, such as blood clotting factors and tretinoin, may interact with aminocaproic acid, affecting how it works or increasing the risk of serious side effects. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Additionally, aminocaproic acid may interfere with certain lab tests, so it's important to inform lab personnel and your doctors about your use of this medication. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, you can contact a poison control center for guidance. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for assistance. It's important not to share this medication with others. Make sure to have regular lab and medical tests, like platelet counts, blood clotting tests, and CPK levels, while taking this medication. It's best to consult your doctor for more details on how to do this. If you forget to take a dose of aminocaproic acid, make sure to consult with your doctor or pharmacist to figure out when to take the next dose. It's important not to take a double dose to make up for the missed one. When it comes to storing aminocaproic acid, it's important to keep it in a tightly closed container at room temperature, away from light and moisture. Make sure not to freeze it, and avoid storing it in the bathroom. And always remember to keep all medications out of reach of children and pets. When it comes to getting rid of aminocaproic acid, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.